Welcome to the Smart Health One-on-One pre-recorded webinar. Part 1 focuses on the cell phone or tablet application. Our platform and devices provide the ability to capture and measure diagnostic data remotely through Bluetooth, cellular, and wireless technology. The devices are provisioned to help pair on your first transmission, meaning they will sync to a user account right out of the box through the use of our mobile application downloadable at Apple App Store or Google Play Store and runs on smartphone, tablets, or TV. The platform is designed to accommodate the needs of CMS Remote Patient Monitoring CPT codes 99453, 99454, 99457, 99458, and the value-based Medicaid initiatives, as well as the wide range of telehealth needs. These programs are part of CMS strategy to reform how healthcare is delivered and paid for, offering better care, better health with lower cost. You will see from our presentation how the software and the home monitoring equipment was designed to support these goals. The interface you are currently viewing is the user view of our phone app. In the lower bottom of the screen, you will see 3 lines that represent options. There are multiple options to choose from, and one of them is HIPAA terms and conditions. When a user downloads the phone app, they will be required to accept our terms and conditions covering the safety of their data before they continue to use our platform. Once accepted, it will default you to the Home menu. In the Home menu, you will see an icon for each of our connected devices and the last measurement value, event, time, and outcome. The outcome value is based on ADA and AHA guidelines. In the top left, you will see a refresh icon, which is used if you lost a cellular or Wi-Fi signal. You can click on it to reconnect to our platform. Across from that, on the top right corner of your screen, you will see a bar graph icon. If pressed, it will give you an expanded view of your data in a graphical view. You can change the view to daily, weekly, or monthly view of your data. We also track each measurement uploaded and provide you a logbook view and outcome based on your personalized goals or goals prescribed by your doctor. Included in the report is the testing average value and what % you are in range versus out of range of your personalized goals. In the top right corner, you will see a white paper plane icon, and if pressed, it will give you the option to send a fax or email report of your data. You will have the option to send a 90-day, monthly, weekly, daily, or provide your own custom date range of your data. The app will look up all the contacts on your device or allow you to add the person to fax or email the info to. Uploading data from our connected device is one simple step. Press the plus sign and any device that is being used will connect to the app and displays the message detecting the device. The reading can also be inputted manually by clicking on the icon of a notepad and a pencil on the top left corner of the screen. Only the device that is activated will appear on the screen, but for the purpose of this presentation, I added the most popular products icon. In this presentation, we are going to upload a glucose reading for a patient that is insulin dependent, and the doctor has set the parameter requesting the patient to input the insulin usage. Firstly, the test result displays on the screen, then the question requesting input on how many units of short-term insulin was taken at this time. The user can also provide a note for additional information regarding the test results. As an example, if the user is not feeling well. Other factors can alter the reading and can be documented if the test was taken after a meal, medication, exercise, or if the user is having a mood swing. The user can document additional information about the test results that could help decipher what is contributing to the test results by selecting what foods were eaten or what medication was taken and/or what exercise was performed. The phone app options menu is the 3-horizon line we call the hamburger menu. When clicking on this option, you can select the third-party data integration. This option enables you to other home testing devices that is not part of the Smart Health One-on-One line. This includes Dexcom Continuous Glucose Monitor and the Fitbit product line. You will be asked to enter your user account for these 2 brands, but once you have added them all, your data from these brands are acceptable to your healthcare team. This is a big help for them as it provides the additional data in one centralized location to view and create notifications from that data. Also included in our app is online support created that will eliminate any confusion during the learning curve. The user simply clicks on Options and selects Support. Our support center can educate the user or troubleshoot the problem verbally or use our popular screen sharing technology, giving our support center the access to view what the patient is seeing and also giving us the capability of taking over control of the screen and showing the user what to do. It isn't necessary for the user to find these special features on their own. Included with each sale of Smart Health One-on-One home monitoring equipment is our welcome call to the user confirming that the product was delivered and helping the user with any questions. We will assist them through their first test and verify that the test results uploaded correctly. During this welcome call, we will show the user the special features that is offered so that they know that they are never alone. We also check and verify after 3 days that the user has uploaded their test results to the internet. If not, we communicate with the user to verify that the equipment is working correctly and that they are testing. 3 other options available through the Options screen is Patient Goals, Medication Schedule with Reminder Technology, plus Uploading Options. Patient Goals is where a patient can define what they consider is low or high. Each measurement you take will look at these goals and provide you the statistical outcome based on your goal, or the goal can be set by the doctor. Medication Schedule and Reminder can text the notice or create an automated phone call letting the user know what medication should be taken and when. The app can also inform a third party that the medication may not be taken as prescribed based on the collected usage report. Smart Health One-on-One offers a pill dispenser as part of the Home Monitor lineup of products. If this product is in use, then there are many other options available. The dispenser will know if and when the medication was taken and if it wasn't. In some areas, the pharmacy will mail a pre-filled tray to the user's home and all is needed is to set the tray into the dispenser. The dispenser will do the rest. Each user account has their own personalized mailbox. The icon is in the lower bottom of the screen, messages that can be sent and received. Clicking on the message will expand and show you the body of the message. The message can be deleted by swiping to the left. The black paper plane icon functions as the send message icon. The user may communicate with the care team member through this personalized mailbox, and each time a message is sent, it will alert the user in a form of a push notification to a smartphone or tablet. The app will allow incoming video calls from your doctor or care team. The user can decline the call or accept it. If accepted, your smartphone or tablet will launch the video camera from your device and be connected for a virtual visit from your care team. Due to COVID-19, this feature has become more popular as you can conduct an office visit through our technology. The app allows the care provider access to view all patient data as they also view the user. Through the push and pull technology, the provider can demonstrate the proper use of the equipment to the user from the provider location to train the patient on the use of the device. The first part of this webinar has come to an end, and part 2 will follow. Welcome to Smart Health One-on-One pre-recorded webinar. Part 2 will focus on the platform. This is the Smart Health One-on-One Clinician web portal. New users must accept the HIPAA terms and conditions to accept our platform on the initial sign-in. The page you are currently viewing is our patient menu. The menu options are on the left side of the screen. On the top right of your screen, you will see the personal mailbox. We are currently logged in as Dr. Demo, and the mailbox can be viewed either through the web or in the app. The mailbox enables a message to be sent to one patient, multiple people, or it may be a broadcast message to the entire population. All messages can be saved for future use or for documenting the activity. Patient monitoring rules used in our platform can be viewed, altered, and new ones created through the expectations sections of the platform. The rules can be used to trigger alerts and/or notifications. We label the menu as expectations due to the fact that these are the doctor's expectations of the patient to maintain good health. If the doctor's expectations are breached, then a notification is automatically sent to the patient via a text, recorded phone message, or with a live support staff. Our platform was built to track your patient's vitals, time, adherence, reminders, trending data, and weight change. In the expectation menu, you can use the template monitoring rules our platform has available to use as is, or they can easily be customized. In this same section, you can create a new monitoring rule by clicking on Create New Rule. Each rule type you create, you will be given a new rule name. An optional message for your patient and/or care team is also available for each rule. The message will be displayed when the monitoring rule has been triggered. You will also have full control to customize the rule criteria for the reading type condition to analyze it by the value. The value can be attached to one patient, multiple patients, or the entire population. These are the options on how the patient will be notified. One or more can be selected for the same task via phone call, text, fax, or email. The voice is a pre-recorded voice message, or the voice can be computer-generated through the text message. Time scheduling enables the doctor or caregiver to select the device reading type and then choose the time the test is expected to be taken by the individual patient or by the entire population based on the condition type. The adherence section enables the doctor to select the number of times the test should be performed and how quickly a reminder is sent out if the adherence protocol is not followed as prescribed. As an example, if the patient is prescribed to test 3 times per day, and at the end of the 3rd day only 2 tests per day were performed, then the patient will be alerted and asked to start testing 3 times per day. The trending data rule was created to recognize bad trends and to alert the doctor of these situations. For example, I am selecting the glucose level hyper notification rule. I can now set a criteria to evaluate how many times it's been triggered with the option to analyze it hourly, daily, weekly, or monthly. A use case scenario would be if a patient has 2 back-to-back readings that are very high. You can set up a custom message that is alerting you based on trending data to acknowledge something is happening and needs more attention. Another use case example is you can create a monitoring rule that does not notify anyone, but our platform is still evaluating the data for you to use as a trending rule. For example, borderline hypoglycemia, hypertension, may not be enough for you to be alerted, but you can create a trending rule to monitor it if it happened X amount of times in a month, and you're now seeing that upward trend in those patients to proactively monitor with a different notification type. Reminders can be set up to simply remind a patient or the population of patients for multiple reasons. The system can isolate any patients whom are not testing as prescribed or have not taken their medication as prescribed. You have full control of the message you want to send, how the message will be sent, and what would be the next step to engage the patient. The monitoring rule will allow you to monitor excess weight gain or loss from the last measurement received from the patient. Welcome to Smart Health One-on-One pre-recorded webinar. Part 3 focuses on the patient menu portal. Onboarding a patient to the account is done by selecting the Create a New Patient option. You will then be asked to create the username, password, additional demographic details of the patient, and the option to assign a condition to the patient. All patients are stored in the patient menu. You can run filters to query a patient or scroll through the list. Then click on the patient to view the patient's dashboard. In this situation, we are selecting a patient with a name of Demo User. We created the patient menu to be utilized for remote patient monitoring, so the features I am going to demonstrate is designed for a healthcare team to view a patient with at least one chronic condition. After select Start PM Session, you will see an option for RPM, CCM, and manually input time spent on a patient. The manual option use case was if any staff member spoke to the patient and was unable to log into the platform, they can still manually add the time spent with the patient. Once the patient monitoring option is selected, you will now see a timer at the lower bottom of the screen with an option to request a video call. If pressed, it will launch a telehealth session. The patient will receive an incoming video call from you, and if accepted, both parties will be able to see and hear each other via the device camera. Both parties have the ability to turn the video portion off, and also both parties have the ability to redirect the camera outward so the device camera may be utilized to position it to show a wound or movement from a body part. Due to COVID-19, the regulations changed by the physicians can bill for telehealth services without the traditional face-to-face and sign-up procedure. The physicians have been using our platform for RPMs as well as telehealth. The 7-Day Stats submenu provides the doctor with a 7-day summary of the patient's data, offering a quick view of the past 7 days of test results. How many notifications were triggered from this patient, we refer them as exceptions. This is the summary view of the current month patient monitoring session count, the amount of time spent with telehealth, and the total amount of time spent with RPM. Also included in this report is the statistical data for the last 7 days for each piece of equipment to be utilized. The Readings and Graph option defaults to the past 7 days, but you do have full control to change the date range. The Readings option allows you to view more details about the test result graph. When selected, you will see an expanded view of the graph as well as the electronic logbook and a Smart Health star rating. I will explain how the star rating is generated later on in this presentation. This patient is rated at 4.5 stars out of 5. The outcome and rating is based on American Diabetes Association's and American Heart Association's guidelines. By default, our platform provides you the star rating based on the patient's performance for the data range that was selected. For example, you can select to view test results by the time of day, morning, afternoon, evening, and night. The data is shown with each test independently or as an average test result. The averages are also available by time of day, enabling the doctor to view the morning average. Selecting Breakdown Graph will provide additional details of the report. In this example, the report separated the systolic and diastolic readings, offering the doctor a clearer view of the test results. Exceptions that were triggered by the patient can be viewed with filtering options. The More Details button will show what test results generated the trigger, and the additional circumstances that supported the trigger, including medication, food, exercise, mood, and any additional notes the patient provided with their testing results. In patient monitoring, you can view all the patients that are being monitored in a group or individually. The report displays how much time has been gathered by CPT code. The platform will track the billable time, and after reaching the required time, the platform will identify the code available to be reimbursed by CMS. If selected, you will get a description of the code. Also included is the intervention report that summarizes the data in a statistical view, listing each time the platform received an exception from the patient. The report also displays the type of intervention that took place and how it took place, choosing from emails, text, recorded phone messages, or live operator calls. At the bottom of the report, it displays the percentages of the type of interventions and the number associated with the percentage. In this section, notes can be added as a public note or private note. By default, all notes are private and can only be viewed by the author and the staff appointed to the patient. A public note can be viewed by the patient and anyone the patient is sharing their data with. In the Goals section, you can view or edit the patient's goals. Goals are set to ADA and AHA guidelines, but you have full control to change it. We also include the Smart Health Star criteria for you to view as a reference. Under the prescribed test rate, you can assign a prescribed test rate based on the patient's personal needs. The test rate may be selected for daily or weekly. The report focus can be for one patient, or you can run a report for the population. For ACO or insurance companies, the reporting could view one doctor's practice compared to other doctors in the area, or the report can be created to view one area compared to another area or state by state. The device list displays what equipment is being used by the patient. The serial number, brand name, and device description information transfers to the internet automatically when the equipment transmits for the first time. No manual inputting necessary. The product is tracked by serial number, and without approval, the item cannot be used by another person and data transmitted. The engagement population report is based on the population of patients by category, by doctor's office, or by territory. There are many reports you can run in this menu, but I will focus on just a few key ones. The reports compares the patient prescribed test rate requirements, your global goals of what you set as high, low, and good. If not, it looks at ADA and AHA guidelines and gives you statistical data in real time. In this report, we include your active patient, and out of those patients, how many are engaged, meaning they are following the prescribed test rate requirement, and out of those patients, how many are within a good or not good range. We also include out of all of your patients which ones are not engaged, meaning they have not uploaded any readings. Besides the statistical data, you may select any value and you will see the list of patients that were involved in the count with an option to visit their profile. The Visit Their Profile option will open a new screen and take you to the patient's individual stats with the option to start a patient monitoring session, all within the same date range you pulled from the population data menu. The report analyzed by outcome will provide you with a statistical view of where your population stands statistically based on American Diabetes Association's and American Heart Association's guidelines. You simply add your date range, reading type, and sub-reading type, and now you have real-time access where your population stands overall and individually with the option to visit the patient profile and launch a patient monitoring session. The report analyzed by HealthScore creates the star rating by comparing the patient test results to the American Diabetes Association and American Heart Association guidelines. From this comparison and multiple other comparisons, including the patient's engagement report, generates the star rating. The report is set to evaluate the outcome based on all the devices a patient may be using, if they are following protocol, and if the numbers are within the acceptable range. This section allows the selection of staff members who will be involved with viewing and managing patient data. To add a new staff member, simply press Create a Staff, and then invite the staff member via email or manually. The staff member can be given full access or limited access. The newly added staff member can receive notifications and also give the permission to create expectations. In the Healthcare Team section, one doctor has the ability of sharing patient information with another doctor. For example, the patient's primary physician can invite the patient's endocrinologist to view the patient's data, and the endocrinologist can also bill separately for the monitoring time. The Smart Health platform enables 2 or more physicians' offices to view the same data, create separate notes that all can read. In the Conditions menu, the patient can be labeled by their condition. This enables the medical staff to send out notifications to one patient or the population based on a condition, view reports by condition, and verify if the population with the same condition is globally becoming healthier by the medical team's approach. Through the PM Sessions menu, the care team can view all the patients who have been monitored in the history of each patient, displaying the total minutes of patients monitoring filtered by the date. Also displayed is the CPT codes that can be billed and how much time has been designated towards the patient's care based on the filtered date. Also included is the option to view the intervention report for each patient that is being monitored. The report can be exported or printed. The Exceptions menu offers every exception the platform triggered by population. The report may be filtered by date range, reading type, rule type, or by the patient. The details of why the exception was triggered is also available to view. In the settings sections, your profile may be updated. Global goals and patient default guidelines can be adjusted. The standard settings are those created by ADA and AHA. The platform was created for the world to use, and all unit of measures are available. The default is set for USA metrics. In the security section, passwords may be changed. Also included in the settings section is where the global guidelines that create the health star ratings are maintained. Only the administrator can make changes in the star rating section. Smart Health One-on-One offer public APIs enabling data to be pushed and pulled from our platform to others seamlessly. We understand the importance of the transfer of information, and there isn't any additional charge for this service. Every feature that has been shown to you in this pre-recorded webinar is attached to APIs, so if you can dream it, we can provide it to you. As an administrator, you may manage multiple offices or different practices and run population reports from each one of them or all of them globally. For example, an ACO, managed care, or third-party administrator could track each practice's overall performance and compare their individual performance, or their overall performance by any criteria that is needed within your organization to track. Throughout our platform, we include educational tutorials for each screen being viewed, or if the user prefers, they can click on the button Tag Along. This is a powerful customer help solution that Smart Health offers. Tag Along works on the phone or table app as well as the computer and is available to the patient or the client. It is like having a guardian angel whom will be watching what you're doing as you do it and can explain how to do it correctly or show you the correct way. Included with each new patient that signs up to use the platform, or if new home monitoring equipment is shipped to the patient, we offer a welcome call to the patient under your company's or doctor's identification. We offer assistance in the setup and explaining the basic tools to obtain support or to connect the tag-along option. With permission, our support center will monitor the patient for 90 days to confirm that they maintain adherence to the doctor's testing protocol and that they stay engaged. The Smart Health platform has been supporting the telehealth industry for 2 decades and would like to include you as a customer. Please contact us to sign up or to start a pilot.